this is happening. This is real. Hopefully everything's happening. It's all go, because I've just sent an email out to people to say that I'm live. So allabitLastminute.com, but I think actually it's worked out quite well. I think my timing's pretty good. Live on Facebook, live on the Gram, live on the Tube. Let's not forget the Tube. So evening all. Hope you're all well. And if you have any questions, as you know, you can just ask away. But if you haven't, then that's fine. You can just sit back, relax, and we will see what other people have got to say, because we've got some preordained questions here already. God, look. Oh, Sam's in the house. Asking about you, Sam. Hope you're doing well. Hope your new business venture is working out. Thank you for today. I came to see you, Chloe, but you're gone. So yeah, don't say eek. Don't say what eek. Right, just let's, yeah, come on. I was really pleased, Chloe. I think you will be pleased. But yeah, I hope you're well. I hope you're relaxing at home, and you should be putting your feet up, really. But here we are, and we got ourselves some questions, which are just here. So my first question involves tattoo. Is my tattoo suitable for excision? So I will show this tattoo. Oh no, wrong button. So this this won't obviously work well on the podcast, but anyway, so if you're listening to this on audio, there's a tattoo on what we would call the ulnar border of the hand, which is the sort of little finger side of the hand, over the bit of skin that doesn't have hair on it, and it's known as the thenar eminence. And whilst this tattoo has got some good features to it that would make it conducive to having it removed by excision, mainly the shape of it, in that it's sort of oblong shape, because it's Roman numerals. So the worst shape for a tattoo excision is a circle. So a circular thing would be hard to remove, but this is kind of long and thin. So the most important dimension is the narrowest dimension. It doesn't matter about the longest dimension, or at least the longest dimension just means it'll be a longer scar, but the narrowest dimensions is the important dimension, because that's the bit we have to kind of stitch together. So so that's quite good that it's kind of oblong shape. That's a favorable shape for a tattoo to be excised. Two problems with it. The first problem is there's not a great deal of spare skin on the hand, particularly because the hand has to move and things, although that bit of skin doesn't move that much. So I don't think it'll come out of one go. I think it will require 2 sessions to remove it. This patient, I believe, is from overseas, I think America, but is coming over to Europe and says it's okay, can come to the clinic and stuff, because they're coming to Europe. But so I think it's important that I get this message to you before you come all the way to the clinic. So what I would say is that I don't think that will come out in 1 session. I think it'll take 2 sessions. If you imagine getting this piece of skin to this piece of skin, I don't think it's going to go. And the other problem, which is a significant problem, is it's not a great place for a scar. The ulnar border of the hand is not a great place for a scar. It's quite an important place to, when you're writing, when you're hi Jackie, when you're doing anything. That's quite a, there's padding there on the hand for a reason. If you just bang your hand down on the ground, or you're tapping on something, or that bit of the hand has got padding on it for a reason. And if you take quite a significant portion of that skin away by excising it, and then leave a scar there, it can be quite sensitive and not a great place for a scar. So whilst technically it would be possible to remove this tattoo in 2 sessions, I don't think it would, shape wise it's favorable for excision. I would say this is excision is probably not a great option for it. Now the problem is, it looks like they've had laser and the laser maybe has kind of faded it, but it hasn't got rid of it. So I'm not sure what the other options are. I always say laser is the kind of first choice for tattoo removal, but it's a tricky one that I can't hand on heart say that tattoo excision would be a great option for this. So if you've tried laser, if I'm saying excision's not a great option, that kind of, I don't really think leaves you with any other options apart from accepting the tattoo. If you really can't accept it for whatever reason, if there's some reason that that has to go, it could be removed by excision. But I think that would cause potentially more harm than good, to be honest with you, because of the discomfort of having a scar on that area. It would have to be closed quite tight, and it might distort that sort of quite nice bump, that nice sort of padding we've all got on our hands in that area. You'd be removing all that and bringing that palmar skin up, and I just don't think it's a great one, especially if you're coming from overseas. I wouldn't want you to come all the way from overseas for me to tell you this, because that would be bad and that would be potentially a wasted journey for you. So it's good to have this conversation prior to seeing you. But thanks for letting me show you photo. I think it's always helpful when we can show photos on these things. Adds an extra dimension, obviously not to the podcast, but oh god, that's ending the live video. Okay, now I've got to get the photo off. Okay, that's moved me in the photo. Okie dokes. Just gonna remove. Right. Oh god, I'm just sorry. I reversed the camera. Okay, I just from problems on. Aha, stop sharing. There you go, got rid of it. Okay, so we've got a question on Instagram. Do you do anything for a surgical scar? I had a nose job with lip lift, but there's a scar. I tried laser. Yeah, do stuff for surgical scars for sure. The question is always, if someone says I'm not happy with my scar and they want something done about it, the question is always, what's the problem with your scar? And we kind of really are looking for an answer to that, rather than, well, I've got a scar and I don't like it. Because if you've got a scar and I don't like it, a surgeon can't really remove that scar for you. They can only change the scar. So there kind of has to be an aspect of the scar that you don't like in order for us to see if there's something we can do about it. So if it's just the fact that there's a scar there, difficult. If it's dented in, lumpy, in a bad line, it probably won't be in a bad line. So I'm guessing it's sort of at the sort of junction between your nose and your lip. So that's more for traumatic scars on the face if they're in a bad line. So if it's dented or lumpy or red, I mean, laser can help with red ones. There are things to do. Certainly if redness is a problem, massage and moisturize is the main thing. Lumpy scars, silicone, steroid injections can be considered. And then dented in or scars in bad, unfavorable lines could consider surgical revision. But I'll tell you now, lots of people say they want removal, really, scar removal, but not many people actually get it done because we're limited as to what we can do. So there are things we can do to try and improve scars. We can't get rid of scars. We can try and improve it. If you've had a lip lift and a nose job, I'm thinking a plastic surgeon did it. So you've got a scar which is given to you by a plastic surgeon. So even less options for improving. And the first thing I would say is you've got to wait about a year really to give it a chance to settle, because it might settle. But yeah, so time is probably the most important thing. Moisturize and massage, and then looking if you've got one of those specific issues that might be able to help with. But we're quite limited as to what we can do surgically to a scar without giving you another scar. Adu on the book, on the Facebook, no, on the YouTube. I have lipoma on my thigh. How much will it cost me, and how do I book appointment? Straight to the point, Adu. Straight to the point, my friend. Right, Adu. Couple of issues here we've got to unpick here, and I know people say you get evasive when they ask about price. It does depend on the location, on the size. So Thigh, that's an open book there, Adu. Could be a little thing, could be a massive great thing. If it's a little thing like that, it's going to be, I think the starting price is 798. I think it's about that. It's about 800. Includes histology, includes all the aftercare dressings, etc. If it's bigger, it might be more. So what we normally say, rather than saying prices, because I don't want to get in trouble by saying, oh, it's this price, and then you come into the clinic and we say it's a different price, is we ask you to send us a photo. So you can WhatsApp us a photo. If you go to the website, I'm pretty sure, I better check this now. I'm pretty sure if you go to the tattoo page on the website, tattoo removal, there is a link to contact us on WhatsApp. So I think you should be able to get a link there, or you don't have to be at WhatsApp. Actually, email. You can just email us, info@staianoplasticsurgery.co.uk. Anyway, if you can send us a photo, number one. I understand often lipomas are difficult to get on photo, so I get that. Unless it's kind of right underneath the skin. The problem with lipomas is they can be deep, they can be at any level, and it's hard to tell how deep they are clinically. So we often would ask for some kind of scan. Ultrasound is probably the most common. So depending on the size and the location, although we know the location is thigh, we would often ask for a scan. And the thigh is one of those ones where I'd be more inclined to ask for a scan unless it's really obvious and quite small. But if it's not really obvious and or not quite small, then a scan would be advisable, which you might be able to get, your GP might be able to help you with, just to see what it was. If they couldn't, we can source that privately. God, how much is a scan? I think it's a few £100 for a scan. I'm not entirely sure. I'm going to say 200 or 300, but I don't. Oh, I should know this, really, shouldn't I? But I think that's what it is. We can tell you that sort of stuff, though. If you get in touch, Adu, if you give us an email, drop us an email or what have you, and yeah, we can certainly give you an idea what the cost would be involving, but it's more helpful to see the size, really. I hope that's not too evasive. I think I've been criticised before for being evasive when people ask the cost of stuff. I'm trying not to be evasive. Just say, we don't want to drag you. We're not trying to entice people in and then, we're going to do a hard sell on you. We want to be open and transparent about our prices before you come to clinic. So that's why we say, look, send us a photo. We'll have a look. If you've got a scan, give us a scan, or at least a scan report, and we'll give you an idea of how much it will cost before you come to clinic, because we certainly don't want to waste anyone's time by coming to clinic if it's going to be too expensive. Do we have any female surgeons at our clinic? Short answer, no. No, we do not. No, there are female plastic surgeons, but we just don't have any at the clinic. They're all male-dominated area. Not sure what more I can say. What can I add to that? No, we haven't. But we do have chaperones, and there's always a female in the room for a male surgeon and a female patient. There's always a female chaperone. It's quite important to us and to you as well. But no, we haven't got any surgeons who are female. All along, how much for a tummy tuck, and do you use drains? Oh God, Salma, I don't know how much for a tummy tuck. Is anyone on who's had a tummy tuck who knows how much it is? About £8,000. I don't really know. I don't know, Salma. But if you I'll tell you what, Salma, if you go to the website and you go to the tummy tuck page and you click something like request a price, it sends an email with the price on it. And it depends on whether you have liposuction. If you have liposuction, it's more. So it's between £5,000 and £10,000. I'm not sure exactly. Sorry, Salma, I don't know exactly the price. But again, we're not trying to be evasive here. Just click the request a price and I'll send you a thing with a price. And do you use drains? Yes, Salma, I do use drains for tummy tucks. I don't use drains for that many operations, but tummy tuck is certainly one of the ones that I do routinely use drains. And I've done a blog post, Salma, about drains and about why I use drains. I believe that they reduce the risk of seroma. And so I do still use them for tummy tucks, but I am quilting. So I'm thinking about whether I don't need to, so I might move away from them. Many people are moving away from drains, but tummy tucks are still one of those ones that I do use, and they're suction drains. I feel that they sort of suck down that sort of space quite well. But no one really likes drains. I pretty much always take them out the next day. So they come out the next day before you go home. So you stay in overnight, then we have a look at the drains, get you up and out and take the drain out the next day, and then you go home. Do you know what prices your mole removal starts at? Very price heavy episode today. Yes, I say I do. I think Lorna, it's 798. I think it's something like that. It's and we're all adults here. Let's call it about 800. I think it's about £800 for a small mole. It depends on size and location. That's why I'm always. I did a video called "Cost of Mole Removal" and got loads of comments saying you're not saying the cost. You're not saying the cost. But you can have a big mole. You can get big moles, and you can get them in difficult areas, and you can get them in easy areas. So like on the nose, for instance, there's not much spare skin, so a sort of what might be considered a small mole on the nose might actually be considered by us to be quite big. Similarly, on the tummy, a mole that the same size would be considered small, if that makes sense. Same size mole on the tummy would be small, than on the nose would be considered bigger, simply because the difficulty of the areas. Thank you. Is that dependent on size? So yes, it is dependent on size and area. So that's again why we say to people, send us a photo, we will give you a price. So but that's the starting price, and it's a one price. I was going to say one price fits all. One price. One price in terms of follow up and aftercare and all that sort of stuff. That's all included in the price. So you don't have to pay anything more than that. That is the price. Consultations and everything, led by surgeons, looking after you, coming back if you've got any problems, all that sort of stuff. You don't have to pay at all. Selma's going to have it 100%. That's good. That's good. Looking forward to that, Selma. Can you talk about BII? I had gummy bear implants 450 submuscular, and the results are horrible. Okay, well, BII, Beyontex. So you say the results are horrible. Okay, I'm struggling a lot of autoimmune symptoms now. Yeah, so BII is more of a thing about. Oh, Corinne, nearly deleted you or something there. Sorry, pressed the wrong button. Good to see you. BII is not really a cosmetic thing. So BII is a breast implant illness, and it is more of a thing that is symptoms that are deemed to be due to your breast implants, rather than a cosmetically unfavorable result. So I don't know what you mean by results are horrible. I'm unhappy. I had tubeless small breasts before. I'm looking to remove them now. Yeah. So if you're unhappy with the look of them, that's one thing. BII is sort of not related to the look of them. That's people who have often kind of autoimmune symptoms, brain fog, hair loss, skin rashes, joint pains, and they believe the implants are causing them, which and then when you remove the implants, they get better. The problem with breast implant illness is that there's no medical cause to say that implants cause those problems, number one. However, there's a large number of women who have those kind of symptoms, and then they remove the implants and they feel better straight away. So it seems to be something there. And the number two thing, there's no real kind of test that you can do to say whether you've got breast implant illness or not pre-operatively. So it's always a bit of a worry when someone says, I've got these symptoms and I believe they're my implants and I want them removed, because you can't guarantee the symptoms will get better by removing the implants. You have to say, look, there's no evidence to say that these implants, your symptoms will get better, but there are women out there who have similar symptoms to you who believe it's due to their implants, and when you remove the implants, they feel better. And often that's more of a problem in people who are happy with the cosmetic results. So you often get people who are very happy with the cosmetic results, but feel they've got breast implant illness. So that's actually more of an issue, because you're actually having a negative cosmetic outcome from the operation in the hope that you'll get a positive outcome in terms of their breast implant illness symptoms, but you can't guarantee that. You can guarantee the negative cosmetic outcome, but you can't guarantee that they'll feel better. Often they do. So it is it's a really difficult area. What are you saying? And now it looks odd, but I also have so if it looks odd, you might have another reason to remove your implants because they look odd, and also you feel that they're making you feel unwell. Do you perform explants? Yes, I do. I need the capsules removed as well. I've done the research. I need my health back. Yes, absolutely right. Beyond text, a lot of women who, and again, this is something we have to kind of do in conjunction with you as a patient, as to what you do with the capsules, because in again, for medical reasons, there's no evidence to say that the implant's causing these problems, and there's no kind of medical indication to remove the capsule, because if you remove the capsule, which is the scar tissue that forms around the implant, it does increase your risk of complications. It does make the operation a little bit more complicated, because you have to actually cut that capsule out, whereas if you remove the implant, that's quite an easy operation. But actually removing the capsule as well adds a level of complexity to the surgery, as a level of risk, and in terms of bleeding and scarring and what have you. So it is something to be discussed. But you're absolutely right. A lot of patients out there with breast implant illness do feel that the capsule needs to be removed, because that is sort of part and parcel of the implant, and that's absolutely fine. If you want the capsule removed, it can be removed, no problem, but you have to be aware of it. The other thing is, I think, did you say here, let's just scroll back, did you say you had them under the muscle? Always a bit of a worry. Submuscular, yeah, always difficult when you've got them under the muscle, getting that capsule off the posterior wall. I suppose that's more of a technical thing, really, to have to get into that. But when you have the muscle under the muscle, the back wall of the implant is straight onto the rib cage. Yeah, punctured lungs. Yeah, you got it. Beyond text, you've done the reading. I've inquired for that. I'll call the office number tomorrow as well. Call me beyond text. Call me 01214543680. We should have a number like in Australia and New Zealand stuff, 0800 plastic surgeon or something, but that's more for the old phones with the numbers on them, the letters on them. I'm able to work. I have on it had them for a year. Oh, I only had them for a year, but since then I've been suffering. Yeah. Oh God. Yeah. I'm sorry to hear that beyond text, but for sure. Yeah. Call me. Yeah. Only had it for a year. Yeah. Well, as I say, I've got to be honest, I haven't done many, but the ones that I have done in terms of removing these implants, the patients have actually felt well straight away. But it's always a worry that you're going to do one and they're not going to feel well, and you remove their implants and you think, oh no. But it has been quite dramatic how well people do respond to it. So it does seem to be a thing, but it's very hard because, as I said, there's no test for it. 1 day post-op, very grateful for your help, Jonathan. 1 day post-op, 1 day, so far so good. Excellent. Yeah, so good to see you here. So what about drainage? That's also like, oh, that's good. Nice to hear. Hope you had a safe journey home last night. A bit quite late, wasn't it, last night? What about drainage? Yes. So for a capsulectomy, for a total capsulectomy, I do tend to put a drain in beyond text. Yes. Tubes, etc. Describe the explant process. Well, the explant process is you make a cut in the skin. I usually make an inframammary incision. Often you already have an inframammary incision, depends on how they put the implants in first time around. But if they put it in through an inframammary incision in your fold, I use the same incision that you've got. Cut that incision out, take the implant out. That's the explant done. Easy, job done. When you're doing a capsulectomy, a little bit more difficult because that's the scar tissue around the implant. One of the problems with doing capsulectomies on people for breast implant illness is that the capsules are often very thin. If you've only had them in for a year, those capsules are probably going to be thin, and it's actually quite hard to do a capsulectomy because that implant is thin. Often, usually, I would say you're doing a capsulectomy for someone because they've got what's called capsular contracture, which is that scar tissue. So the capsule is basically scar tissue that forms around the implant. Is that scar tissue contracting around the implant, making it feel hard, and it progressively gets harder and harder and harder until it gets really uncomfortable, and they want to have a capsulectomy. In those situations, that capsulectomy is actually a lot easier because they've got a really hard capsule that you've got something to sort of fight against, something to work against when you're doing a capsulectomy. But in terms of patients with breast implant illness, often they just got a really gossamer thin capsule, which is like really wispy, and it's actually quite hard to remove. But Will my body dissolve the scar? Yeah, I mean, the body it won't dissolve it, but it will just sit there. I'll get surgery again, but never implants again. Yeah, this scar, so you don't actually need a capsulectomy. The capsule can just stay there. The capsule has got, is just is scar tissue. But patients with breast implant illness feel that there are bad things in the implants which will have got into the capsule. So they kind of feel the capsule is kind of part of it. So it's very common for people to want to have the capsule removed when they're having a explant surgery. But if you didn't have the capsule removed, it would just be scar tissue that would just sit there and not cause any harm, and it wouldn't, so you don't need to have that capsule removed. So that, again, that's probably a discussion really for the clinic as to which way you go with that, whether you have it removed or not. But there's pros and cons, no doubt about it. There's risks with removing it, but then I guess there's risks of leaving it. Nothing flies to my body, knows. And does a capsule form after a year and a half? Yes, it does. The capsule forms pretty much straight away, I would say. Yeah, no, it will have a capsule. The body walls it off in scar tissue pretty much straight away. So for sure there'll be a capsule, but it'd be very, very thin capsule beyond text. There won't be much. It won't have much substance to it. But yeah, but the body will have kind of walled it off in scar tissue. So it will be in a capsule at a year and a half. Do you do fat transfer for my breasts? Yes, I do, beyond text. I do fat transfer for your breasts. But again, needs a discussion because it's quite subtle, the results of fat transfer in my hands. Personally, I don't really think we got it there in terms of getting big volumes. So it's quite subtle, quite small volumes, quite expensive for what it is compared to implants. Now, I'm not saying you should have implants because you've been harmed by your implants by the sounds of it, but it is quite subtle. So again, needs a discussion whether you, but I do fat transfer to breasts, but I don't do it very often. I used to do it all the time when I did breast reconstruction in the NHS, but now I'm doing cosmetic work. I was about to say I never do it, which I think wouldn't be far wrong. I can't even remember. I've done some fat grafting to other areas of the body for issues, but the breast, many years since I've done fat grafting to the breast, although I do like doing it. Can both surgeries be done together, or explant heal then other surgeries? No, you could have an explant and an immediate fat graft. Just got to make sure you put the fat into the, well, you don't actually put it into the breast, you put it around the breast, but you kind of don't want to put it in the space where the implant was. But it would be possible to do an explant and fat graft at the same time. Yes, they can be done together. Or, as I say, it's quite expensive. It's quite subtle, the results. So there is something to be said for doing explant and see what you think, because obviously you're concerned that the volume might be too small, because the volume will be like what you were pre-op. But yeah, you could have an explant and caps and a fat graft at the same time. Yes, you could. Thank you for answering my questions. You're very welcome. So I'm here for Beyond Text. Lorna, you seem a lovely surgeon. A bit more saving, and I'll be definitely coming to see you for my mom. Oh, there you go. We've got ourselves got a cut. I knew this would pay off doing this. Got a customer there. Yeah, a bit more saving, Lorna. Good. That's kind of you to say. Thank you. What else have we got here? We got, do you offer chin augmentations or fillers? That's a no and a no. So we just gained a patient from Lorna, and we just lost one for the chin augmentation patient. No, I don't do facial aesthetic surgery. I do mole, cysts, skin, removal, but I don't do kind of facial aesthetics in terms of rhinoplasties, chin augmentation, and facelifts. I don't do those sorts of things. And I also don't do Botox and fillers. I don't do non-surgical treatments. So no, I don't offer chin augmentation or fillers, I'm afraid. I pretty much stay with breast and body and skin lesions. In the clinic, it's mainly skin lesions, which is mole, cysts, bumps, lipomas, other bits and bobs like split earlobes, inverted nipples, what have you. But no, I leave that to people who do that. So some people do that a lot, and I don't do that a lot. So they do that a lot. I was wondering if you have any surgeons that could look at my left arm after I had birth control removed from my arm. I've experienced some nerve damage. first thing I'll say, it's unusual to get nerve damage from birth control moved from your arm, because it's usually quite superficial. They put that implant in, but unusual things happen. So let's not jump to conclusions. If you were thinking that you have some potential nerve damage in your arm, that would be a hand surgeon, I would have thought, be most likely to need to see, which is either there are plastic surgery or orthopedic surgeons, both are hand surgeons. So it is a subspecialty of plastic surgery. Hand surgery is. It's not my subspecialty interest. My subspecialty interest is breast. So you'd be better off seeing someone whose subspecialty interest is hands. So if you're from Birmingham, I don't know if you're on. This is a question that's been asked before, so I don't know if you're here. If you're here, then let me know where you are in the world or in the country. If you're around here, hand surgeons, Darren Chester down at Droitwich, David Azardi in Coventry. There'll be loads, but those are two that I just thought of there. So those are two people who are hand surgeons who, but yeah, probably be a hand surgeon. But as I would say, it's very unusual to damage a nerve from a birth control. But yeah, I wouldn't be the man to see. If I was to have a breast reduction and then go on to lose more weight, would it affect the results of surgery? Yes, for sure it would. So this is one of the important things I always say to people. You've got to be stable and comfortable with your weight before having this sort of surgery. By this sort of surgery, I mean kind of any body contouring surgery: breast reductions, breast lifts, tummy tucks, arm lifts, thigh lifts, doesn't really matter what. Any sort of body contouring, you need to be stable and comfortable if possible. I know we all live in the real world and weight fluctuates, but if you know your weight is going to fluctuate, if you know that you are not happy with your weight, don't have surgery now. Because if you think, oh, I want to have surgery now because it suits me, and then you lose weight after surgery, it's unpredictable. That's the problem. I can't say what will happen to your breast. It's unpredictable, but stuff might happen to your breast. And by stuff, I mean they might get smaller, which you might say, well, that's okay. I don't mind them being smaller because I want them as small as possible, but they might droop more. That might not be okay. So part of a breast reduction is a breast lift. We tighten that skin envelope to make the skin as tight as possible. And if you then lose weight, that the fatty tissue from the breast will go, but the skin won't. So it might make them droop and sag more. So that will kind of work against the lift aspect of the breast reduction. So you're going to get a better result if you can lose weight first. Also, depending on what your weight is, but generally speaking, higher weights are associated with higher complications. So the lower weight your weight is, the less your risk of complications. So if you can get your weight down, it will be a good thing all round before having surgery, ideally. So yeah, it's always the best to lose weight first. What are your incisions for the thigh lift, and can this be incorporated a mons? And can this incorporate a mons pubic reduction? So there's two incisions for thigh lift. One is in the kind of in the groin area, on either side, I guess, of the mons area. The mons area is where your pubic hair is. I don't tend to do that personally. I say I don't tend to do that. I should just come out and say I don't do that because I don't. I've done it. It's subtle results, risk of bad healing, risk of complications, and I can't make it work. I mean, people obviously can because it's out there and it's a technique that's being used in the world. So people obviously can make it work. It's just I can't. So if I'm going to do a thigh lift at all, and it's not a common operation, it's only really for people with a lot of spare skin. And if you've got a lot of spare skin, the best way to do a thigh lift is kind of taking the skin out in a side-to-side way, rather than the incision that's up in the groin, which is sort of pulling the skin up. It's never an up-down excess in the thigh. It's always a side-to-side. So that pulling up doesn't give a great result. The best result is by taking skin from the sort of making the circumference of the scar of the thigh less, by putting a long incision in the medial aspect of the thigh. So the incision goes from sort of up by your groin straight down to just above your knee. So it is quite a long incision in the medial aspects. We try and hide it by putting it in the medial aspect of the thigh, but it is quite an obvious incision, certainly compared to the incision that's up in the groin area. So there's no question it's a more obvious incision, and if you're wearing short skirts or short trousers, you will be able to see that incision. So you might say, look, forget it. I don't no way on earth, because you're saying I want a thigh lift because I can't wear short skirts or short trousers, but then I give you a scar that you still won't be able to wear those short trousers. So you might say, look, there's no way I'm having that, which is absolutely fine. But in my hands, that's the only way that I will do a thigh lift, because those are the best results I feel I can get. I cannot get good results by putting the scar higher up on the thigh area. So I don't tend to on the groin area. I don't tend to do that kind of incision up in the groin area. But as I say, it is being done out there in the world, so you will be able to find someone, I'm sure, who will do that. It's just not this guy. So good. So I'm glad to have some interaction with Beyond Text and Lorna Brooke. Thank you for that, and Adu on the YouTube. So I won't be back next week because I'm on holiday. I'm going mountain biking, I think, to Bike Park Wales next Tuesday. So anyone else there, say hello to me, and hope that I survive it. But yeah, but the week on Wednesday I will be Tuesday. It's Tuesday today, isn't it? Week on Tuesday I will be back in the saddle, as it were. Well, I'll be in the saddle next week, but I'll be back in the saddle, this kind of saddle, a week on Tuesday, and 7 p.m. Don't miss it, because it might, you never know, it might be as enthralling, as informative as this one has been. It might, I can't guarantee it, it might not, but you know. So yes, so if you're got nothing better to do, 7 p.m. week on Tuesday and every Tuesday thereafter, I will see you then. So if you don't mind, I'm going to stop the stream and go and put my feet up, because I have 2 big days of surgery and my back, oh dear, right.